Now, let us start with the case history taking. While taking the history, usual mistake done by the juniors is they just start the case history by taking the name, but actually start taking the case from the date. Never forget to put the date first and then start the preliminary inquiries. If you don't put the date in the beginning, when they come for their next consecutive uh, visits, you may find difficult whether they have come early or they have come after a long gap or they have come in right time. Because if they have come early, there may be chances of the acute exacerbations of their suppressed condition, because our medicines remove the suppressions, thereby the actual condition may come to the surface. Thereby you may have to prescribe an acute medicine to correct or clear the acute exacerbation. If they have come in right time, then you may have to inquire whether there was improvement or there was no improvement, or there was improvement and come back. The complaints have come back. Usual tendency of the patients is to say, oh, it is not yet got cleared. But at that time you inquire whether there was an improvement and setback or no improvement at all, or was there any increase in the complaint and it has come down. Basing on that, if there was improvement and came back, you may have to repeat the same medicine. If there is an aggravation and there is an improvement, then also you can do the repetition. If there is no improvement and if there is an acute exacerbation, then you may have to give an acute emergency medicine to reduce their acute exacerbation. So, the putting the date is more important for your consequent prescriptions. After the date, next you have to write the name. In the name, so along with the name, you have to mention even the initials, so that when there are two patients with the similar name, you don't get confusion. Following that, you have to write either the son of or daughter of or wife of, so that that also give a proper identification of that particular patient. After that, the age, because certain conditions are particular to certain ages, so that it will be easy for you to diagnose or suspect what may be the condition in that person. Next, after the age, then come to the, if they are students, inquire regarding their education, or if there is a, they are the working person, what work they are doing is more important. Because, for example, if he says he is doing a business, inquire what kind of business he is doing. Because if it is a chemical business, there may be the occupational hazards from the chemicals. If they are doing some other business like any rags business or even the pesticide business, these things give us the, or if there is a provisional store business, there are chances of physical exertion also. So depending on their occupation, so it also gives you the clue for the occupational hazard as well as the influence, and also help us to select their medicine. If he says the person is an engineer, inquire what kind of engineering he is doing. Because if he is a software engineer, he will be working under comfort zone and also under constant exposure to AC condition and also a screening time will be more, so that there may be a chances of getting a respiratory problem or indigestion problem or eye problem. So when you ask them engineering, you ask them what engineering they are doing. If he is a mechanical engineer, there are chances of physical exertion as well as exposure to the cutting oils or machinery oils. If he is a chemical engineer, if that he may be exposed to chemicals. If the person is a teacher, also ask what kind of teaching they do, because the mathematics teacher is more exposed to the chalk dust. The social studies teacher is more exposed to the speaking, so there may be strain on their throat. So depending on the type, and also ask them what is the nature of their work, whether sedentary work or executive work. If it is an executive work, also ask them they move about only in the city or they keep going out of the station also. If it is a sedentary work, also ask them the proportion or the comfort between the chair and their table is there or not, because many times if the height of the table is more than the required height, there are chances of getting the shoulder pain. So if one is a beautician, also usually there are chances of getting the neck pain because of their work while doing the brewing. So the main duty of the doctor is to keep observing what are the things may happen during their work. So while taking the occupation, you must inquire what kind of occupation they are doing. If they are students, what they are studying, because nowadays there will be more tension in 10th standard students and also the second PUC students. And also see whether their education is going proportionate to their age or not, so that if there is a delay, also inquire why there is a delay in their education, because the delay in education may be due to a lack of memory. Lack of memory due to, the lack of memory may lead them to get failed in their subjects, and particularly the mathematics, because for mathematics reasoning is more important. If there is a lack or rather less reasoning, they find difficulty in doing the mathematics, for which usually Madan will help, which improves the reasoning capacity of the person. If they are getting difficulty in studying the social studies, because they have to study the long paragraphs and who are unable to retain for long paragraphs in their mind, happens due to the lack of, rather due to poor memory. So if many times we have seen the children or the parents, they say they don't remember anything. That is because what we have observed is they are studying without knowing its meaning. When they start studying with its meaning, we have seen their memory has improved and they could retain, and advise them not to aim at the marks or examination. They have to aim in acquiring the knowledge. Thereby it will be easy for them to study and keep in the memory. So if it is, sometimes we have seen in the delay in education, due to the household situations or the financial situation. So even then we have to advise them as to how to acquire the knowledge, and so thereby we will be able to understand whether there is a memory is poor due to their weakness or due to the situation at home. Next, after this, we have to see whether the marriage has taken place or not in the appropriate ages. If it is a delayed marriage, also inquire why there was a delayed marriage. If there is sometimes what happens if the marriage takes place in the early age itself, early age means inappropriate early age, then we have to inquire the patients whether they had the will to get married or by force have they married, so that many times these suppressed feeling due to the force by the parents may lead to many complications or the disturbance in their health. So this also has to be noticed. Next we come to the address. The address is to be taken to know whether there is any factories in that area, or is it a Parthenium area, or any particular trees is spreading the pollen, or any factory near their house, and which may lead to the problem in their health. And also inquire regarding the cell phone towers, which is causing the major problem in the hormone imbalance and also in their menstrual disturbances. So to know all these things, address is necessary, and sometimes if necessary to visit or to send the information, the address is also necessary. The phone number is necessary because if there is any emergency at the clinic, or if there anything to be informed to the patients, if the phone number is there, it is better. So note the phone number also. After this, we go for the list of the main complaints. Usual tendency of the patients is to tell only one complaint rather the major complaint for which they have come. Inform them that we need all the list of all the complaints that they are having, because we treat them as a whole, and each complaints are not a separate complaints but a separate phases or the different phases of the same complaint. After joining all these complaints, it gives us the complete picture. Because usually they come to us after going to the allopathy doctors. In the allopathy doctors, for eye complaint, you have to see the ophthalmologist. So skin below the eye, you have to meet the dermatologist. So the ophthalmologist will not treat the dermatologic problems. But whereas in our complaint, in our system, we treat all the complaints together, and each of them are not same but belong to the same person. The person is one entity. He is not made from spare parts. He is not made. He is evolved. Many times this complete picture gives us the clue for the selection of a proper medicine to clear their complaint. So when they say one complaint, also ask if there are any other complaints also. After taking this, inquire them what made them to go to the doctor to notice these complaints, or they usually as the patient come to us with the ready-made diagnosis, that to get that diagnosis is of little importance for us for the selection of our medicine, because with the same diagnosis each patient differs in their suffering. Allopathy doctors have studied well the disease conditions, but we have studied well the person with disease condition, because each person is different, so the disease expression by each patient will be different. So the selection of our medicine also will be different. So while inquiring or starting the case history, ask them what made them to go to the doctor to recognize their diagnosis, because each one will not go to the doctor with the same, though with the same symptom, though the disease is same. Like for example, in diabetes, one may go to the doctor due to the delayed healing, another may go to the doctor due to the sudden loss of weight, another may go to the doctor due to the excess urination or maybe blurring. But all the patients will not having all the complaints. So from where it started is more important for the selection of our medicine than the word diagnosis or the name of the condition. And also that during the acute exacerbation of their complaint, also ask them whether they notice any other symptoms uh, in them where they can notice that their complaint is increased without getting it tested. For example, some patients say, see doctor, if I get blurring, I know my blood sugar is more. If I get the headache, vertex headache, I know my BP is more. Or if I get the urination more, I know my blood sugar is more. Or if I get lethargy, I know my TSH must be more. So by noticing certain symptoms, patients themselves notice that their condition is more. That's why these things also are more important for the selection of our medicine. In one case of diabetes, where the patient expressed that his wrinkles in the skin increases whenever there is a blood sugar, where the Bovista could help him to reduce his diabetic condition. In another case, where the parching of the lip with increased thirst gave us the clue to select bryonia to reduce their blood sugar. In another case of arthritis, where the joints pain had started in the left ankle, then to the right ankle, then to the left knee, then to the right knee, then to the left hip, then to the right hip, then left shoulder, left elbow, left shoulder, right shoulder, and then to the nape, which was looking like the movement of the snake. On that basis, after prescribing lachesis, we found the arthritic patient who was completely bedridden could move about and has forgotten regarding his complaint. So, the mere arthritis also didn't give us the clue for the selection of our medicine. This movement or the sequence of the pain in the joint gave us the clue to select lachesis. Same way, when the complaints start from the bigger joint and go to the smaller joint, or it is only in the bigger joints or only in the smaller joints, or the joint pain is starting in left extending to the right, or starting in right extending to the left, and also whether the joint pain is shifting from left to right or right to left, or it is shifting randomly in different joints, also give us the clue for the selection of our medicine. Because we have seen the complaints which start from left and go to the right, that is extending to the right, is lachesis. Which starts in right and goes to the left is lycopodium. If it is shifting from left to right, right to left, then it is lacocaninum. And if it is shifting randomly from one joint to another joint, not in a particular pattern, also gives the clue for the selection of pulsatilla. So, in one case of joint pain, who used to feel better from diversion has given the clue for the selection of acid oxalic, which helped him to get rid of his problem. So these tiny symptoms or the prominent symptoms which make them to stand out from the rest of the patient is an indication for the selection of our medicine. I hope from these things now you know how to take the case history, and not only that, while taking the case history with all the main symptoms, you have to start with duration, location, sensation, modality, concomitant, causation. In modality, time modality, temperature modality, postural modality, diurnal or nocturnal modality. These things also give us the complete clue for the selection of our medicine. When usually the doctors, junior doctors get the doubt that if we take all these things, so don't we get into the confusion? One thing you must remember that usually the tendency of patient to express the complaint first, which troubles them more than the sequence of other symptoms. So these main symptoms with the indication of modality or temperament or the seasonal modality or food modality, this gives us the clue for the selection of their medicine, when what we call as the nucleus, which covers the majority of their all other complaints. So learn to notice the nucleus, that is what made them to stand out from the rest of the other similar patients is more important. Same way, to understand the nucleus of the drug, juniors has to study the materia medica, first Nash, then Farrington, then Kent, then Clark, then Murphy, then other books like the M.L. Tyler, Hughes, or other book, Boric. These things will help you to glance the medicine during your doubts. And not only that, while studying, as I told you, by the time you study the book in this sequence, you will get the nucleus of that drug. So while patient expressing their nucleus, you can easily select your medicine. It's like, you see, there are so many animals outside your house. But if I say one animal is barking, you say it is dog. You don't get the doubt either whether it is a cow or cat or sheep. So this barking is the nucleus of that animal. Same way, each patient or each drug gives us the clue, and if you understand the nucleus, you can easily select your medicine, and also helps you to select the medicines among the indicated drugs easily. Second.